I've often wondered what would happen if we opened the newspaper tomorrow morning and the headlines read, "Medical research proves that men and women are different." And I think we would all chuckle at that because we know intuitively that men and women are different. And we think when we go into our physician's office or our healthcare provider's office that we are getting personalized care, especially based on the fact that we are men and women. I mean, we have different parts, right? That's pretty obvious. But you might be surprised to know that medical research is built on a biased pipeline. We start medical research with cellular studies, and we move on to animals, live animals, and then we go to human trials, and then we take those results and we apply them to the patients. But if you look at the numbers along that pipeline, they are very surprising. For instance, the majority of cellular-based studies, they don't even think about the sex of their cells. Did they come from men? Did they come from women, males or females? And when you move into the animal studies, even in research where the disease is predominantly in women, 80% of the animal models are in male subjects. And then you look at clinical trials, the ones that are funded by the National Institutes of Health and other funding agencies. 67% of the subjects in our human trials, our late phase trials, are in men. Yet when you get to the clinic, to who is seeking care, 80% of healthcare consumerism is women. So we have a biased research pipeline. Research is the foundation for clinical decision making for every healthcare provider. So if you take biased data and you apply it uniformly to the global population, 50% men, 50% women, you are going to get some adverse outcomes. For example, when we look at 10 drugs that were pulled from the market by the Food and Drug Administration, what we find is that 8 out of 10 of those had a majority of reactions and deaths in women. Why, you might ask? Well, it's probably because those drugs weren't adequately studied in women. And then you look at diseases where we have designated those as women's diseases, like osteoporosis. That's your grandmother's disease, right? Well, you might be surprised to hear that men are under-screened, under-diagnosed, and under-treated for osteoporosis. And the majority of research in osteoporosis treatments have been in women. So the research bias applies to both men and women and boys and girls. And at the Laura W. Bush Institute for Women's Health, we believe that simply not knowing the difference doesn't mean there is no difference.